morning. My name's Jonathan Mkungudza, and I'll be presenting on the risk of neurological birth defects in births periconceptionally exposed to antiretroviral therapy in Malawi. I have no conflict of interest to disclose, and quickly allow me to start with the background of our work. As many of you know, that the WHO in 2010 emphasized on the importance of establishing defects surveillance. However, few African countries have succeeded in doing this, even though high HIV prevalence make it important for these birth defects to be monitored. We all know that ART has greatly reduced vertical transmission. However, we still have concern about their possible effects on neurological defects, particularly around if the exposure is around conception. So in Malawi, we launched birth defect surveillance in 2016 to monitor 20 major external birth defects and also explore ART-related risks. I'll be sharing our preliminary findings, specifically on association between periconception exposure of ART and the NTDs. Our methodology. We selected 4 hospitals with high volume delivery and in the district where we have high prevalence of HIV. So at each hospital, all live and informative stillbirths were assessed, tracking 20 major external birth defects. We abstracted HIV and the ART information from maternal records. We had trained midwives who examine every baby, take photos and write narratives following maternal consent. These birth defects are verified by site physicians and a study manager, and then the information is sent to CDC Atlanta for final confirmation and the diagnosis. In this analysis, we included all confirmed birth defects. Our data analysis involved estimation of neurological birth defects prevalence by maternal ART exposure at the periconception. We defined periconception as exposure at least 1 month through our first trimester. Our analysis was disaggregated by ART drug type, as you can see. We used binomial regression to calculate adjusted prevalence ratios, adjusting for maternal age, parity, and ANC attendance. The data that we included was from 2016 December to December 2023. However, we must note that there was a pause from July 2020 to June 2021 due to COVID. Over 271 beds were assessed across the 4 facilities, with Baira registering the highest number of beds assessed. Nearly 10% of beds came from women living with HIV. About 13,439 were periconceptionally exposed to ART, with an even distribution between the ART type. What did we find? As you can see, the prevalence of neurotube defects was about 3.5 per 10,000 births, higher in births periconceptionally exposed to ART compared to birth to HIV negative women, with a prevalence ratio of 2.1, and it was statistically significant. Disaggregating by ART type, the prevalence of neurotube birth defects was nearly 8 per 10,000 births. In births periconceptionally exposed to efavirenz compared to birth to women, to HIV negative women, with prevalence ratio of 2.2, and this was also statistically significant. There was a prevalence of 5.7 per 10,000 births, higher in births periconceptionally exposed to DTG compared to birth to HIV negative women, with a prevalence ratio of 1.9, and this was not statistically significant at 5% significance level. In summary, our preliminary findings suggest that there is an association between periconceptional exposure to efavirenz and the birth defects, and this is statistically significant, confirming our concern about their use, particularly in early pregnancy. While DTG was not statistically significant, there is a need to monitor the birth defects and the support to larger studies. Our findings concur with other studies in the region, like the CEPAMO, which also found that the DTG exposure was not associated with neurotube defects. I acknowledge the women who contributed greatly to this study, and also acknowledge our funders, CDC, and the PEPFAR. Thank you so much for your attention.